Trauma is recognised as a psychological wound and can be caused by a range of experiences. Trauma changes how a person sees the world, how they remember things, how they think, and how they feel about themselves and other people. As children, we develop a blueprint of what our life is like. You can think of this as a puzzle. This includes the people that we trust, our place in the world, and whether we feel safe. When someone experiences trauma, it is as if all of the puzzle pieces have been thrown in the air, scattering the pieces. The person now must try and put those pieces back together. Sometimes people need the help of counsellors and professionals to do this. Sometimes there is permanent loss, and so there are pieces missing. And sometimes things have changed and the pieces are misshapen. As a housing worker, you may also experience vicarious trauma. This happens when a worker's worldview and feeling of safety is disrupted by hearing about someone else's trauma. As a housing worker, you will be working with clients and colleagues who have experienced trauma, so it's important to recognise the signs. These can include heightened emotional responses, withdrawal, poor hygiene, anxiety, intrusive thoughts, and memory lapses. Trauma-informed practice requires you to use empathy to look beyond the behaviour to possible underlying causes. People who have experienced trauma may experience triggers, which transport the person back to the traumatic event. Triggers can be caused by smells, sight, sound, touch, or particular events. A trigger may cause a person to respond with disassociation, withdrawal, or with heightened emotions. The person may have their own specific strategies to deal with these triggers. When we are dealing with clients or colleagues who are having a strong response to a situation, there are some things that you can do. If they are withdrawn or disconnected, support them to feel safe by paying attention to their physical space, helping them to become aware of their current surroundings, and directing their attention outward rather than inward. For heightened emotions, use a calm and reassuring voice. Don't try to argue or reason with the person, and make sure to stay at a safe distance. Use open body language and try to get the person to sit down. Agree with reasonable requests and validate their experiences. Finally, call the police or a crisis service if the person is a risk to themselves or others. The language that we use is very important. Remember that we and our clients deserve to have choice and respect. Some ways we can aim to use trauma-sensitive language include avoiding labels, judgment, and jargon. Using person-first language also reminds us not to lose sight of the person in light of the condition that they may be experiencing. Remember that the way we talk about people matters. Trauma manifests in many ways. Understanding and identifying trauma will help you support your colleagues and clients effectively and empathically. Let's hear some examples of how we integrate this into everyday work practices.
There's lots of stuff going on, there's lots of trauma, there's lots of stress for people who are experiencing homelessness or insecure or inappropriate housing. You know, lots of people's reaction to a stressful situation is to become heightened. So developing good facilitation skills so that you can demonstrate empathy, you can ask some good open questions. You might be able to assist them to be a little bit mindful. So it's always good to ask somebody, what strategies do you use to centre yourself again? So lots of people have the skills they use. So really being able to normalise and let somebody know this happens, this is okay, let's explore this is not a weakness, and we want you to take the time to process it.
You have to acknowledge of what you're going through and what clients are going through. Validating and understanding emotions as they arise, both in yourself and in others. So it's continually checking in. It's looking at what your role is, being hopeful. Okay, so being hopeful doesn't mean you have to be Pollyanna all the time. Being hopeful just means that you see where the client is and you're trying to move them towards safety and you're walking alongside them. So that's you doing your best job. It's It's safety, it's clear, it's consistent, it's hopeful, it's optimistic, it's transparent records, so it's being really process driven and making sure you do your job properly. It's being consistent and stable, it's being predictable, and it's doing all of those things every single day. So it really is walking your talk. So you've actually just got to live it out every day.